David, how do you feel?
Very comfortable.
Wonderful. For doctors watching, you're seeing this very complex case of Radial Keratotomy with transplant. Visibility is extremely poor. We have already worked on a very complex posterior corneal or posterior polar lenticule, and now being very fastidious about putting the lens on a correct axis. And the patient, as usual, has no IV sedation. Right, Dave?
No,
He's a wonderful chiropractor. David, how would you describe your experience here?
Very relaxing. The staff makes you feel very comfortable.
Wonderful. I'm inside your eye right now in this very complex eye. Doctors, you can see my visibility is extremely poor. I'm sitting with my hands on one side and back on the other. And David, how's your comfort without any anesthesia, any IV sedation, just numbing?
Yes, very comfortable. There's no pain with the procedure.
Perfect. So you can see this multiple over 20 card RK. You can see right here in the central transplant. Visibility is poor, but we are being very fastidious. We already finished the surgery. You're seeing the lens now going on axis exactly as is here. And David's wonderful chiropractor. David, are you comfortable?
Yes, I am very comfortable.
Doing very well. Congratulations. Okay, so now it's the big one coming out. The medium evaluation. So you can see here multiple over 20 card RK, a transplant with residual sutures, very high regular astigmatism. We are able to remove the posterior polar lens, put in a premium technology with the axis. You can see here the dots matching the mark from the cornea, and taking those stitches, we have ingeniously hydrated his incisions. And here, very important, look down here, we actually went through his previous extensive LRI, limbal relaxing incision between the AKs, and used that disadvantage to our advantage and entered there. And you can see here, completely sealed. David, are you comfortable?
Yes, I am.
Super. See here as I'm testing, incision is nicely sealed. And look down. And you can see the parasite pieces I went through. The LRI is also nicely sealed, that is completely dry. And you can see the stability of the chamber. We're very proud of you. Drop, please. David, you're all done. How do you feel?
I feel fantastic. Thank you for having the courage to help RK patients like myself. You have given me the fountain of youth, so I really appreciate it.
How was the feeling during surgery? David, for doctors who are watching, you saw this case?
The surgery itself was pain-free with just using the numbing drops. And being a cornea transplant patient, I can appreciate not being under any anesthesia. And I really, really, really appreciate that.
For doctors who are watching, amazing. All my patients are amazing. David's another amazing patient from Atlanta. He's in the medical profession himself. And he has had a full thickness transplant on top of his over 20 cut radial keratotomy incisions, along with limbal relaxing, very large cuts along the periphery. So it became very difficult. How do we even enter this eye? And my desire for no stitches, remember? So we went in, we actually played through his LRIs and went through his RK area in the periphery, no scleral tunnel and excessive pain through the cornea. And then the visibility was so difficult because of the deep chamber, and we've gone in and removed his polar cataract and put in a premium toric lens on the axis as best as you can see with a two-hand toric technique. And then we took no stitches. You saw my hydration technique there. And here he is. No IV sedation. There is no anesthesia, drops. David, anything you want to say of your experience, given your IQ and your knowledge before traveling here?
I'm just really grateful that you have the courage to help patients like myself. Thank you.
Pleasure, absolute pleasure. All right, David, all done.
Congrats!
How do you feel?
I feel fantastic. I'm very grateful that Dr. Gulani pretty much gave me a new lease on my eyes. I was turned away by every other ophthalmologist that I visited, and they said that there was absolutely nothing they can do until I reached my full potential of cataracts. And so I really appreciate Dr. Gulani's passion that he brings to the field of ophthalmology and to all the RK patients, because we need him in our corner. There's nobody else that's fighting for us. So thank you, Dr. Gulani.
Congratulations. Get some rest in the
Yeah,
hotel,
will
please.
do.
I'll see you.
Okay, bye.
Careful, please. Careful with your eyes. Careful. All right, here he is, Dave. All done? How do you
Yes,
feel?
I feel fantastic. I'm just very happy I came to Jacksonville and had the experience to meet Dr. Gulani and his wonderful supportive staff. I mean, they make our life so much easier.
Been a pleasure, man.
Thank you, sir.
You take care of patients and been a real honor. You guys being complex, that's not your problem, it's my responsibility. And for doctors watching, this amazing guy who takes care of patients himself in Atlanta, right?
Yes.
And came with unbelievable complexities, irregular corneas, transplant over his 24 cut RK with limbal incisions. And we just removed his early cataract out of that. No stitches, no drugs, you're walking out, ready to roll.
Amazing. Amazing. Thank you, thank you. I was gonna say, I'm gonna end with God answered my prayers. No doubt.
Absolutely agree.
So-
Absolutely agree. Yes.